that Ghana's fight against COVID-19 was indeed challenging, especially with the backdrop of corruption scandals. Now, despite these challenges, the government set up several systems to combat the pandemic, including the scramble for vaccines to save many. My colleague Sarah Penkro has been finding out the lessons Ghana has learned from the management of COVID-19 in this report.
On March 11, 2020, the World Health Organization declared the novel coronavirus COVID-19 outbreak a global pandemic after more than 100,000 cases in 114 countries and 4,291 deaths had been recorded.
By the alarming levels of inaction, we have therefore made the assessment that COVID-19 can be characterized as a pandemic.
It was indeed a devastating moment that hit the world like a bolt from the blue, exposing the vulnerabilities in global economies and affecting various sectors. The Alpha, Beta, Delta and Omicron variants were the various mutations of the virus which was on the lips of many. The pandemic did not only disrupt industry, it resulted in unemployment and triggered global recession. Trade, education, healthcare were not left out of the impact. Tourism especially was arguably the hardest hit following closure of major airports around the world.
Effective 1 a.m. on Monday, 30th March, some 48 hours from now, I have imposed restrictions on movement of persons in the Greater Accra metropolitan area and the Greater Kumasi metropolitan area and contiguous districts.
On March 12, 2020, Ghana announced its first case of COVID-19. Following the official announcement and the rising surge in cases, the country then instituted a series of strategies, including public health measures like the ban on social gatherings, including schools, places of worship, travel restriction, mandatory quarantine, and the unforgettable partial lockdown of Accra, Kaswa, and Kumasi. Greetings were completely redefined, and sanitizers was for many a new trend for survival.
I think this is relevant that from time to time we go back to look at where we came from and how we are making progress. Generally, I would say we fared well because this was a new experience for all of us. If you remember the predictions at the time, it was as if the African race was going to be wiped out. There were just so many unknowns.
Na me koye Ghana card e wakurase na omka se mu bia nko ba bia enti me kai kura na se wo a me ntimi nko ba bia enti man koye farmer
wo mani wo ni e ko won ya ja no soja fu e gbe no aga ka chon bie ko aye ni den chen.
There was a time ko mortuary e busa e almost say e ade ana e ho.
It was indeed a time of disarray, and frontline workers were up to the task.
Journey that many people in the front line, health workers and others, basically stood up to be counted for. At the beginning, we all thought that there was no end in sight, and we did not know how this was all going to end.
It was new. Nobody had all the answers. So we looked within, and the Ghanaian health worker rose up to the task.
Esther Mausi Botre is one of the critical care nurses assigned during COVID-19, and she tells me the memories are unforgettable.
When I go to the ICU, use it as a form of diversional therapy. I like to sing with them. I'm a Christian, so I would sing Christian songs, all views. And she was a Pentecostal woman, so I would be singing the Pentecostal song. That's a form of encouraging them, because people, they were there, sometimes they have lost hope. And it's not just about the care that you are giving them, not just you're touching them or giving them. Sometimes they need reassuring words.
For Dr. Louisa Kwam, a medical officer at the Ghana Infectious Disease Center, she can only be thankful when she casts her mind back.
I remember fondly the teamwork that we had, that community spirit. There was this blend of fear together with a sense of wanting to should I say, save lives, this sense of self-sacrifice.
Another critical care nurse, Janet Amwa, is however yet to overcome the trauma of the moment, just like many others.
When you care for a patient, knowing that this one is doing very well, but the next day when you come and he's gone, it was quite traumatizing.
Unfortunately, many lives were lost to the outbreak and families were devastated as they had no opportunity to give their deceased dignified burial ceremonies. But many also survived. Gary Al Smith, an influential sports journalist who got infected in the line of duty, is one of the lucky ones.
Initially, I had a change of sensory. I lost my sense of taste, I think, because I remember saying that I had eaten some very hot banku and pepper and I couldn't taste anything, so that was odd. But I paid no heed to it until some of the other symptoms started showing. I think because of my support system, it was not all bad.
Sadly, this was a familiar sound that would never be lost in Ghana's COVID-19 story. Sarah Apenkro, TV3 News, Accra.